Feeding therapy works with individuals with dysphagia, which is a feeding and swallowing disorder, to help them eat better. We work on the physiological mechanism of eating, our ability to put food into our mouth, our ability to chew it and move it around, our awareness of food, and our ability to tolerate different textures and consistencies of food. We also work on your ability to swallow and make sure that food goes safely into the body.
If your child is having difficulty chewing or swallowing food, if they're refusing certain textures, if they're coughing or gagging during meals, even if they're having difficulty breathing, they might benefit from feeding therapy. If they have any of these symptoms and are only eating a handful of foods and overall mealtime's really stressful, feeding therapy would be highly beneficial for not just the child, but also your family.
Believe it or not, a good portion of your child's feeding therapy is parent education and training. We teach you how to create the best possible feeding environment for your child. Beginning with positioning, whether it's in your arms, in a high chair, or at the table, we will see what is most appropriate considering your child's age, safety, and behaviors. Our goals are always safety first, and therefore assess swallowing capabilities, then work on age-appropriate oral motor skills like lip closure or chewing before the introduction of liquids or foods. We will introduce therapeutic strategies and make recommendations for food selections, typically based on texture. Once we see what works best for your child, we will then ask you to try the same techniques during the therapy session. We find that this promotes confidence in carrying over the skills from the therapy room to your home. The duration of therapy will depend on your child's specific feeding issues. Sometimes an issue will resolve very quickly within a session or two, or it may last several months. Either way, the carryover of skills taught during therapy is key. We look forward to seeing you at Child and Family Development.